Hello my dear curious and studious students of surgery, myself Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome dear students in my surgery lecture number 50, that is the hydronephrosis. In this lecture we will cover the hydronephrosis of the kidney, causes of the secondary hydronephrosis, unilateral and bilateral hydronephrosis, stages of the hydronephrosis, types of the hydronephrosis and types of the operations like Anderson-Hines of pyeloplasty. All points we will cover in this lectures. Now first start with the hydronephrosis. Hydronephrosis means dilatation of the renal pelvis and calyces with accompanying destruction of the kidney parenchyma. It is usually caused by the partial obstruction to the outflow of urine. Complete block usually produces acute renal atrophy without significant pelvicalyceal dilatation. Hydronephrosis may occur at any age. Now the etiology. Hydronephrosis may be congenital or acquired. Congenital hydronephrosis means it is caused by obstruction which develop congenitally, that is the pinhole meatus, valves and folds in the urethra. Majority of the congenital hydronephrosis are bilateral. Hydronephrosis may be unilateral or bilateral. Unilateral hydronephrosis occurs when the obstruction is somewhere in the ureter above the level of the urinary bladder. Bilateral hydronephrosis occurs when the obstruction is below the level of the urinary bladder, that is the stricture of the urethra, benign enlargement of the prostate or neuromuscular dysfunctions of the internal sphincter. However, bilateral hydronephrosis may occur due to the bilateral ureteric obstructions. Dear students, here is a good animated pictures of the hydronephrosis clearly shown. There is a normal kidney, there is a mild hydronephrosis, moderate hydronephrosis and a severe hydronephrosis in the kidney. This is the clear picture of the hydronephrotic kidney. This is the ultrasound image of the hydronephrotic kidney clearly seen. There is a dilated calyceal system of the kidney is clearly seen. Now, when there is a definitely detectable cause of the hydronephrosis, it is called secondary hydronephrosis. When no cause can be detected, it is called primary or idiopathic hydronephrosis. Causes of the secondary hydronephrosis are: first, for the urinary hydronephrosis, obvious the cause is in the ureter and mostly it is at the pelvic junction. The cause can be classified into extramural causes, that is the cause lies outside the ureter, intramural causes where the cause lies in the wall of the ureter, and the intraluminal causes when the cause lies within the lumen of the ureter. Now first we will see the extramural causes. Pressure on the ureter by loaded sigmoid colon, gravidated uterine tumors and ovarian tumors. Extramural causes are involvement of the ureter by malignant neoplasms outside, that is the carcinoma of the cervix and uterus, carcinoma of the colon and cecum, carcinoma of the rectum and carcinoma of the prostate. Extramural causes are aberrant renal vessels. These are usually seen at the junction of the pelvis and the ureter. Idiopathic retroperitoneal fibrosis, these are included in the extramural causes of the hydronephrosis. A movable kidney may cause kinking of the ureter to seldom cause hydronephrosis. Next is the intramural causes of the hydronephrosis are: these causes are congenital stenosis or achalasia at the pelvic-ureteric junction. Ureter and the congenital atretic ureteric orifice also cause congenital hydronephrosis. These are inflammatory strictures of the ureter, mostly due to the tuberculosis or following removal of an impacted stones. Neoplasm of the ureter, these are the causes for the intramural causes of the hydronephrosis. Then the C type is the intraluminal causes of the hydronephrosis are calculus in the ureter, congenital folds at the upper end of the ureter. Now the bilateral hydronephrosis. These causes of the bilateral hydronephrosis can be best classified into causes in the urethra and causes in the bladder. First, the causes in the urethra, that is the pinhole meatus, congenital valves, benign prostatic enlargement, inflammatory stricture of the urethra cause bilateral hydronephrosis, carcinoma of the cervix and uterus and carcinoma of the rectum. Second is the causes of the bladder. For the bilateral hydronephrosis are: calculus in the urinary bladder may act as a ball valve to cause obstruction at the urethral meatus to cause intermittent bilateral hydronephrosis. Second is the internal sphincter of the bladder may be unable to open due to the neuromuscular dysfunction, that is in tapes dorsalis or injury to the spinal cord. Third is the neoplasm of the bladder, and fourth is the malignant neoplasm of the adjacent organs may involve urinary bladder or both ureters to cause bilateral hydronephrosis. Now there is another types also, primary and secondary hydronephrosis also. First, we see the primary hydronephrosis. These are mostly encountered in children, and the obstruction lies at the pelvic ureteric junction or at ureteric fascicle junction. Pathology: hydronephrosis is dilatation of the renal pelvis and calyces. The normal pelvis has an average capacity of 7 to 10 cc, that is the ml of urine. The dilatation of the pelvicalyceal system may contain 300 ml to 500 ml of urine. Now, the stages of hydronephrosis. First is the open hydronephrosis, intermittent hydronephrosis and closed hydronephrosis. First, open hydronephrosis. In this condition, the hydronephrosis sac is open, communicated with the lower urinary tract as the obstruction is incomplete. And the intermittent hydronephrosis, hydronephrotic sac intermittently communicates with the lower urinary tract as the obstruction is complete intermittently. That means, when the obstruction is complete, there is a oliguria with enlargement of the hydronephrotic sac and the patient complains of pain in the loin of the same side. Third is the closed hydronephrosis. In this condition, hydronephrotic sac is completely closed from the lower urinary tract. Dear students, here is another image of the hydronephrosis clearly shown, mild and moderate and severe. This is the radiologically differentiation of the grade of the hydronephrosis. That is the grade 1, just renal pelvis visible 5 to 7 mm. Second diagram showing the some calyces visible 7 to 10 mm. Third is the marked dilatation of the calyces more than 10 mm. And fourth diagram showing the narrowing parenchyma because there is a gross hydronephrosis, the fourth diagram. And fifth is the extreme hydronephrosis with only a thin membrane like residual parenchyma rim. Here is the types of the hydronephrosis. Types of the hydronephrosis. 3 types are usually recognized depending on whether the kidney has an extrarenal or intrarenal or mixed type of the pelvis. First, pelvic type, second renal type and third is the pelvic-renal type. Pelvic type: when the kidney has extrarenal, the major part of the pelvis lies outside the kidney substances pelvis. The renal pelvis becomes grossly dilated in the hydronephrosis with minimum dilatation of the calyces. Second is the renal type. When the pelvis is intrarenal, that means the major part of the pelvis remains inside the kidney substances. There is not much dilatation of the renal pelvis, but the calyces are more dilated. This causes early renal destruction owing to more dilatation of the calyces. Third is the pelvic-renal type. This is the mixed type of the pelvis. This is perhaps the most common form in which both the pelvis and the calyces are equally dilated. Type of the hydronephrosis may be unilateral involving just one kidney or bilateral involving both kidneys. Now, here is the hydronephrosis stratifications showing the control group means G1, there is no hydronephrosis, both kidneys are normal, and in the low group the unilateral grade 1 to 3 is clearly seeing the G0 is the control group and G1 is the grade showing 1 to 3 is clearly seen in the second diagram, and in the third diagram intermediate group, that is the bilaterally showing the grade 1 to 2, that is the control group is also hydronephrotic and the trial group is also there, hydronephrotic grade is seen, and in the high group the both kidneys are equally suffers, grade 3 to 4 is clearly seen in this image. Now, the fluid of the hydronephrosis is not stagnant, but it is continuously undergoing changes due to the secretion of the fluid and reabsorption of the existing fluid. Secretion of the fluid is mainly through the glomerulus, whereas the absorption of the fluid occurs through the various paths. These paths are as follows. First is the pylovenous backflow, in which the absorption occurs through veins which lies in the wall of the pelvis. Second is the pilotubular backflow, in which the absorption occurs by way of the renal tubules into which the fluid flows back from the hydronephrotic sac. Third is the pylolymphatic backflow, in which the hydronephrotic fluid is absorbed by the lymphatic which lie the wall of the pelvis. After 3 weeks of the complete obstruction, the affected kidney functions become tremendously deteriorated. Now, the clinical features of the unilateral hydronephrosis are, there are 2 types of usually seen, type 1 and type 2. Type 1, in which the causes of the hydronephrosis are the main presenting features, that is the renal colic and hematuria is a calculus and obstruction, etc. Type 2, in which the clinical features of the hydronephrosis are the main presenting features, onset is insidious and there is a dull ache and a sense of weight on the affected side of the loin. Intermittent hydronephrosis, a few hours later or even on the next day, there is a suddenly excess voiding of urine, polyuria, the pain is relieved and the swelling also disappears. This is known as the Dell's crisis. Now, the third type of the hydronephrosis is the bilateral hydronephrosis. In this condition also two types are there, type 1 and type 2. Type 1, there are symptoms of causes of the hydronephrosis, that is the symptoms of the benign enlargement of the prostate or carcinoma of the prostate. Type 2 is the bilateral renal swelling is firstly complaint of but this is much rare is in comparison to the unilateral hydronephrosis. Now the special investigation has to be done in the hydronephrosis like straight X-ray, excretory urography, retrograde urography. When excretory urography picture is inconclusive, this is a simple method which may be performed by the general surgeon. Retrograde urography. Ultrasound can easily confirm the diagnosis of the hydronephrosis. After 3 weeks of the complete operation, the affected kidneys functions become tremendously deteriorated. Now the treatment, secondary hydronephrosis, the treatment is directed according to the cause of the hydronephrosis. The cause have been described as above. First is the primary hydronephrosis. Mild cases with few symptoms are usually followed up without operation. Now for the plastic operations, pyeloplasty for hydronephrosis, principles for these plastic operations, pyeloplasty operations to reduce the size of the renal pelvis, to excise the pelvic junction as this may be the area of the failure of the muscular or coordination, to avoid the subsequent stricture formation, and the ureter is attached to the most dependent part of the pelvis. Types of the operation are the Anderson-Hines pyeloplasty. The renal pelvis is excised in a V-shaped manner. The lower flap is then turned downwards and the anastomose obliquely with the ureter when the upper flap is closed as usual. Second is the Culp pyeloplasty. This is performed in cases of the moderate hydronephrosis from the pelvis. The renal pelvis and the upper part of the ureter are cleared properly. A vertical incision is made across the pelvic junction from 2 cm above the junction in the pelvis to 2 cm below the junction in the ureter. The upper part of the incision which is lying in the pelvis is carried and then downwards to the bottom of the renal pelvis is an inverted U fashion. The flap from the pelvis is now turned downwards and sutured in the gap between the margins of the ureteric incision. The renal pelvis defect is closed by interrupted sutures. Dear students, here is a good picture of the Anderson-Hines pyeloplasty is clearly seen. There is a pelvic junctions atresia or narrowing. Then it is cut transversely and suture longitudinally. This is the another picture. There is the ureteric catheterization to release the kidney pressure. Then cutting of the extrarenal calyces and suture. Pyeloplasty is there. This is the gross hydronephrosis. Next image is showing and the ureter is blocked. This is the another image of the Culp pyeloplasty is clearly seen in this image how it made. Now the Foley's pyeloplasty. This operation is best suitable for small hydronephrosis. A vertical incision is made from just above the pelvic ureteric junction along the ureter from 2 cm. From the upper end of this incision, 2 incisions are made to diverge from each other, so the whole incision has now become a Y-shaped one. The apex of the Y is gradually pulled down and sutured to the lower end of the ureteric incision to give it a V shape. The sides of the opening are closed with interrupted sutures. This is again drained with a nephrostomy tube for 10 days. Dear students, there are very good videos of the Anderson-Hines pyeloplasty, Culp pyeloplasty and the Foley's pyeloplasty on the YouTube. You can watch it to clear your concepts and to know the difference between these three pyeloplasties operations in the hydronephrosis. Here is the end of our surgery lecture number 50, that is the hydronephrosis. Thank you.